So this is really sad what happened, and this was just this month. It was December 19th, okay? And this is, I'm just going to give a brief rundown. This is a game being played, but I'll explain in a minute. The largest skilled nursing facility in St. Louis has closed suddenly, forcing about 170 residents to be bused to other care centers. Many left with nothing but the clothes they were wearing and arrived at new facilities without medical records and other important documentation. The abrupt shutdown of Northview Village Nursing Home on Friday came after workers learned they might not be paid and walked out. This place that I talked about yesterday that I'm working at, that I just started, I haven't even been there 1 month yet. This is the kind of stuff I could see them doing. I'm not saying they have, but it's because of the leadership they have. I question even if that chief nursing officer is a nurse. She probably is, but she shouldn't be, because it is those leaderships because of their failure. And it's a deliberate failure, and they will fly under the radar and never be held accountable for their actions. So that's what all of this is designed to bring nursing, first of all, under the failed nursing magnet model, because the nursing magnet model is tied in with the state, the federal. Okay, that's what they want to bring in through the communist system. They've had unions helping them do it. If you want to believe your unions, then in healthcare, then keep doing it. They're lying their asses off, though. Don't believe them for a minute. So nobody said a word, somebody had told KMOV. Alvin Cooper of East St. Louis, Illinois, was preparing Monday to fill out a missing persons report on his 35-year-old son, Alvin Cooper Jr., who has lived at Northview Village for several months while recovering from a gunshot wound to the head and a drug addiction. Yes, this was a place that had behavioral health patients as well. They don't know where he is. I've burnt 2 tanks of gas going back and forth to that nursing home trying to find out what's going on. I don't know if he's somewhere safe or what's going to happen to him. The difficulty started Friday when, according to the union representing workers, more than 130 people went unpaid. When employees began to question why their biweekly paychecks were late, they found out the payments weren't coming at all, according to Marjorie Moore, the executive director of Voice, a St. Louis agency that serves as an ombudsman for long-term care residents and their families. The shutdown began as employees voiced their concern. Employees, said Lenny Jones, state director for the Service Employees International Union, SEIU, which represents about 100 of the roughly 130 displaced workers. They ran out of money to make payroll, caused this massive disruption, and just quickly moved forward with their goal, which was to shutter this facility. You would have had to have been planning to move 175 residents in the dead of night. Sherry Ford, a nursing assistant at Northview Village, said she figured something was wrong on Friday when her direct deposit wasn't in her account. This was the only job I had, and I am facing eviction and no Christmas for my family. We were all working forward to this check. This was our Christmas check to do shopping, paying rent, and other things. Marvita Harrison, 59, a certified medical technician, said workers received emails from the company over the weekend promising they'll be paid, but it was unclear when. This is real wrong, Harrison said. I have worked in that building for 37 years. Not only did they mistreat us, they mistreat the residents they take care of. Northview Village has been fined 12 times for federal violations since March 2021, according to the Centers for Medicare and Medicaid. Fines totaled over $140,000 and ranged from $2,200 to $45,000. The reasons for the fines are not available. Northview Village has a 1-star rating system by the federal agency. In addition, the state health department website lists nearly 24 Northview investigations since 2016. The most recent complaint from February said resident was able to get out of the building through an unsecured door. A 2021 complaint alleged the facility failed to investigate allegations that the residents left the nursing home and brought drugs back into it. Missouri Department of Health and Senior Services, Lisa Cox, said the agency was notified 4:15 Friday that the nursing home was closing. The operator implemented an evacuation plan, and emergency medical service workers helped relocate residents to other nursing homes. The final resident left the facility before 6 a.m. Our team continued to work through the weekend, following up with the receiving facilities to check in on residents who had been transferred. Yeah, they were transferred with only the clothes on their backs, not documentation. Phone calls to North Village went unanswered Monday. Calls also were unanswered at suburban St. Louis-based Healthcare Accounting Services, the company that owns the nursing home, and 5 others. It's all been really crazy as we try to make sure all residents are accounted for. Yeah, right. It's a troubled facility, but it's also been a safety net to keep people from falling through the cracks. So that's part of what is going on here. So I said that the place I'm at, they closed their mental health county place that usually people go, and that's why all of this is just it's a scam, and it's on a bigger level than people realize. So I know this is a little hard to see, but this is directly from the website where I'm at, okay? During 2022, acute care and behavioral health divisions worked diligently preparing necessary plans and processes to meet the Joint Commission's industry-wide health equity standards that came into effect January 1st, 2023. The division's respective clinical quality teams created guidelines for their facilities and worked with dedicated personnel to improve current patient intake forms to better identify and improve reporting of inequities among patients. The individual clinical teams are developing resources in coordination with those available in the local communities to support equitable care for patients. All nonsense, all bullshit. This is a game. Our facilities are expected to follow the new guidelines and starting in 2023 provide updates to the respective executive committees and board of directors. This is why I'm saying this. This is a game because Joint Commission, first of all, is supposed to be, if they're pushing the equity stuff, the DEI stuff, then it's all corrupt like most people do, which means I've said this facility is already in bed with the federal government through some sort of agreement. I talked about it before. So they'll be protected, but that's why they don't care. And the unions have been supposedly helping nurses and nursing home workers, and there's no way SEIU doesn't know what they're trying to do. Because these people at the top have been on board with the socialist globalist agenda. They have. All of the unions tie back to it. They've been pushing it for decades. Okay, so they know that this is what has to happen so they can force the government to come in. They have to make it unsafe. They have to stress nurses out. They have to have so many complaints to where it forces the facility to close. Because once enough caves in, this is what socialism does. Once enough collapses, then you can get the federal government to bring the magnet nursing model in for nursing anyway, and they will dictate every little step you make with their failed model, because that's what American Nurses Association signed on for. That's what American Medical Association signed on to. They're in bed with the Bidens. They're in bed with the UN, and the unions are right there in lockstep with them. So until people start getting honest, good employees, good nurses, innocent people will continue to be abused and treated poorly.